Welcome to this presentation of Cerinate One Hour Porcelain Veneers, and congratulations on your investment in the Cerinate One Hour Permanent Veneers Placement Kit. The placement kit contains everything you will need to apply Cerinate porcelain veneers as a permanent restoration for many clinical indications, an economical and aesthetically superior alternative to time-consuming composite bonding, and an affordable, permanent cosmetic smile makeover that is completed in just one visit. In the next few minutes, we are going to move step by step through the successful placement of this versatile treatment option. Denmat makes the only porcelain veneer with over 20 years of clinically proven results. You and your patient can expect an aesthetically superior and virtually leak-free restoration that carries a lifetime warranty when these simple placement procedures are followed. Cerinate One Hour Veneers can be adjusted intraorally, directly on the teeth. However, for best results, we recommend the use of a stone model to ensure a better patient experience and optimum fit. Your placement kit contains a wide selection of tooth shape, size, and shade options. The patient should be engaged in the smile design process. Place the sizing chart against the dentition to determine the appropriate sized veneer for the patient. A slightly larger size veneer should be selected for optimum coverage and final result. Also assist the patient in the selection of a suitable shade using a standard Vita shade guide. The whites of the eye are typically a good indicator in the shade selection process. Begin by cleaning the teeth with a slurry of pumice and water, or use the porcelain laminate polishing paste that is included in the placement kit. If needed, the contacts can be opened with a fine blade seri saw. You are now ready to take an impression. We strongly suggest that you use PVS impression material. However, if you choose to use an alginate impression material, pour the stone model immediately after the impression material has set. Once the stone model has dried, use your placement kit to select the best shape, size, and approximate shade of veneer. Select a shade that comes closest to the desired final result. Fit each veneer to the stone model, selecting size and shape for each tooth to be treated. Veneers that are slightly larger than the underlying tooth can be shaped to fit. Cerinate One Hour Veneers are made of high-strength Cerinate porcelain. You should use a fine diamond burr in a high-speed handpiece with water cooling to adjust the margins. A donut, football, or flame-shaped high-speed fine diamond burr can be used to modify the veneer both pre- and post-placement. Cerinate One Hour Veneers are designed thicker in the center and flatter on the lingual surface. This design feature allows greater versatility. Each veneer readily adapts to flat, ovoid, and round teeth. Shaping of the veneer should start with mesial and distal refinements, followed by incisal and gingival adjustments, thus contouring the veneer for the best aesthetic alignment and fit. With shaping complete, place Porceloc porcelain etching solution in a dappen dish. Apply this to the bonding surface of the veneer using either a disposable brush or scubes. Leave the solution in place for 3 minutes, making sure that the surface remains moist. Thoroughly wash away the etchant for 30 to 60 seconds, and then apply porcelain conditioner to the bonding surface of the veneer for 30 seconds. Rinse the veneer and dry thoroughly. The final step in veneer preparation is to apply Cerinate Prime. Use one coat and allow it to sit for 30 seconds before blowing thin. Once the veneer preparation is complete, place them in the correct slots in the working tray so as to correspond with the position of the tooth to be treated. Close the lid of the tray to protect the veneers from light. Veneers with a Cerinate Prime coating should be protected from light until placement. Re-examine the patient's dentition and, if present, remove any caries. At your discretion, you may also remove the surface glaze from the bonding surface by lightly roughing with a fine diamond burr. This will improve mechanical retention of the veneers. An application of paint-on dental dam to the lingual side of the teeth and gums, or the use of matrix strips interproximal to all teeth receiving the veneers, are options that will expedite the final cleanup and finishing process. If you decide to use paint-on dental dam, light cure. If you are using the Sapphire Plasma Arc Curing Light, this will take 5 seconds. If, however, the option of matrix strips is selected to separate teeth, then no paint-on dental dam can be placed. Next, apply Etch and Seal for 20 seconds. Rinse and dry the teeth thoroughly. Mix together equal parts of tenure A and B in a dappen dish. Apply 3 to 5 coats of this tenure mixture to each tooth until a glossy surface is achieved. Allow this to sit for 10 to 15 seconds and then gently air dry. The teeth and the Cerinate veneers are now fully prepared, and you are now ready for the try-in and shade selection process. The final shade of the veneer can be adjusted with the use of Ultra Bond and the Cerinate Shade Modification System. Be sure to involve the patient in this shade selection process. Start the try-in process by applying Ultra Bond Plus try-in paste to each of the veneers. Gently place each veneer into position, cleaning up any excess try-in paste with a brush. Tenure S should not be used to wipe out the veneers at this time. Once the veneers are placed, position a mirror approximately 16 inches from the patient's face and let them preview the effect. If the shade needs to be adjusted, remove and clean the veneers with a scube sponge or a clean, dry brush. Then reapply a new shade based on the decision you make with the patient. Everything you need, including simple, precise instruction on how to modify shade and opacity, are included in your placement kit. Remember to make a note of the final mixing ratios that achieve the desired result, so you have the materials available at placement. The placement process starts with the removal of the veneers after try-in using a Sure 349 instrument or cotton pliers. Remove the try-in paste from the tooth and the veneer with a scube sponge or clean, dry brush. Once clean, use one layer of tenure A and B and then use tenure S to coat the veneer and teeth. Then gently thin the tenure S coating with air. At this point, the veneers should be returned to their appropriate positions in the holding case and the case closed to protect them from light. You are now ready for placement. Place an Ultra Bond Plus tip on the syringe. Extrude and dispose of a 1/4 inch line of material. This will ensure an accurate mixing ratio. Apply the selected shade of Ultra Bond Plus to the veneer and gently place the veneer on the corresponding tooth. Tack each veneer. This will take 2 seconds per tooth. Start with the centrals, followed by the laterals as you work your way back. Remove excess bonding material using a Tenure S Dabbies sponge or a soft brush coated with Tenure S. Once you are satisfied with overall placement and cleanup has been conducted, any paint-on dental dam material or separating matrix strips used may be removed. Once positioning and alignment is satisfactory and full cleanup has been performed, you next cure all veneers in place with light. This takes 5 seconds per tooth if you are using a sapphire pack light. Using a Sure 349 instrument, remove the cured cement from the margins. Minimal finishing may be required at the DEJ to remove any excess cured cement. Clean up any excess Ultra Bond and carefully open the embrasures. Any area around the margins that may be short can be filled or adjusted using flowable composite. Using a diamond mosquito-nosed interproximal burr, remove the porcelain ledge, if any, and refine the margins along the interproximal areas. If needed, trim and polish the margins of each veneer with an extra fine diamond burr. Then polish with a 12-fluted carbide burr and polishing paste. Explore the tooth structure next to each veneer to check the margins. There should be no catches or bumps anywhere. Use articulating paper to check the bite and a diamond football burr on the lingual to finish the incisal wrap and adjust high spots and length as needed. Opening the contacts can be performed now or at a follow-up appointment. Use a sari saw to separate the teeth with a rocking motion. Rock back and forth, being careful to stop short of the papilla. Finish the process with a Ceri sander to smooth the interproximal surfaces, and recheck for smoothness with dental floss. A final polish can now be performed using porcelain laminate polishing paste with a polishing cup. It is now time to reveal the new Cerinate One Hour Smile Makeover to the patient. Cerinate One Hour Veneers provide a stunning transformation, and patient satisfaction is extremely high. You will both be pleased with the final results of your work if these simple steps are followed.